Government of India has recently conducted its National Family Health Survey 6 NFHS. The results have been released on 13th June 2026. The outcomes show significant progress on several key indicators. While on the one hand, India has continued to grow at an appreciable rate, the NFHS survey results give a clear understanding that India's progress has also been inclusive, with sustained focus on advancing socio-economic indicators. Given the noteworthy achievements of the survey, the Embassy of India, Copenhagen, on Wednesday, the 8th of July, 2026, conducted a press briefing meeting for journalists based in Copenhagen. A number of persons attended the press briefing. Indiavision brings you the summary here.
Is that no one should be left behind and there should be universally acquired good health for the entire population of India. So we are striving for that. We are not yet there, but I think that we have made good coverage and good progress. So that is why, friends, I wanted to share these key indicators of National Family Health Survey 6, and the briefing notes are already with you. Maybe in your work you will find it useful, and I welcome all of you to take a good look at these indicators. And of course, if you have any comments, I would be very happy to listen to them. If you have concerns, I would be happy to transmit it to Government of India. And here I would like to stop. Thank you. I would like to say that India and EU are now strategic partners in many senses. And so we are not only talking about trade and investment and defense and security, but all kinds of cooperation which would benefit the population from both sides, our peoples. Of course, India needs a lot of good partners in our health planning also, and universal health coverage, which we aspire to achieve. So with European Union, we definitely would like to take steps in improving our health facility, doing joint research, planning, and doing a lot of activities together, which would bring benefits for the health sector in India. And if India can bring some benefit to health sector in EU, we are very happy to contribute. I would especially like to do some micro, from the EU level, go to the Danish level, that we are already doing this under India-Denmark Green Strategic Partnership. And in the health sector, there is already a joint working group between India and Denmark. And the health officials from India and Denmark meet together time to time. There was a recent delegation of National Disease Control Center, National Center for Disease Control, which was here. Hassa, you were also present. They had very good cooperation with the State and Serum Institute here. India and Denmark are working together on antimicrobial research, and there are some other good research projects also going on in the diffused, health sector is a very big sector. I know that Danish foundations like Novo Nordisk take a lot of interest in research in non-communicable diseases, and we are working in these fields also. And there are experts available in this room who are also working on different kind of health programs in India. So I think that with the kind of high technological expertise which is available in the European Union, good research facilities, India and Denmark are already working together on various kinds of programs. Indian government would like to benefit from what is happening in Denmark. For example, the digitization of health records in Denmark, which is already being practiced, is something which should also be done in India. So Indian administrators came in a delegation and they were taken to different hospitals in Denmark to see how data portability in Denmark works. For example, Hasse, you are yourself a doctor, right? So if you go to one doctor and then to another doctor, your health record can also be seen by another doctor. In India, that is not the case so far. So we are working on that direction also. So I think that there are a lot of learnings here, and joint research and joint implementation of projects. I would also like especially that a lot of Indian students should come to Denmark for medical or other kinds of pharma and other kinds of studies, so that we benefit from these kinds of collaborations also. India, right from many decades, India has been the most populous country on earth. India and China were the two most populous countries on earth, right? And there was also this thing that we have to control our population, because a large population you have limited economic resources, so the population size should come down. Right from 1970s, India started on a population campaign where government's encouragement to the citizens were that married couple don't have more than 2 children. There was a lot of awareness campaign through various kinds of advertisements, public outreach, social awareness, economic awareness. Government's health programs also provided these kinds of facilities and incentives that family size should be limited to 2. I mean, children should be, a family of 4 is an ideal family. Governments of India and Denmark both are working together to see the possible mobility of nurses and healthcare workers from India to Denmark. It also depends upon internal Danish government regulations also, that whether these nurses are actually needed and in what time frame. So subject to that being sorted out, we are ready to cooperate. And some of the agencies from both sides are already working together with each other to lay the pathway. So Government of India and Government of Denmark had an agreement signed in 2024, which is called Migration and Mobility Partnership Agreement. So the structure is already there now. Now we have to implement it.
Good.
Thanks for watching Indiavision. Subscribe and be updated.